So welcome to Unit 13, Treatment of Abnormal Behavior, Module 73, the Biomedical Therapies in Preventing Psychological Disorders. These slides align with Myers Psychology for the AP course 3rd edition. This is kind of a long module. There are 4 learning targets. The first is to examine how therapeutic lifestyle changes are actually considered an effective biomedical therapy, not something we often necessarily consider. Next, describe the drug therapies and how double-blind studies help researchers evaluate a drug's effectiveness. Third, to discuss how brain stimulation and psychosurgery are used to treat specific disorders. And then finally, describe the rationale for preventative mental health problems, not just reactive types of treatments, but what can we do to prevent mental health problems from developing, and evaluate the importance of the concept of what we call resilience. So what is a lifestyle and how does it impact mental health? So our lifestyle, the choices we make to exercise or to sit on the couch, maybe playing video games, to eat healthy foods, or to grab prepackaged processed goodies, the relationships we choose to nurture, the activities we select for recreation, how we relax, whether or not we have religious or some sort of spirituality in our lives that we're engaged in, all of these things affect our mental health. So let's think back. You can see some of these cave-ish type people in the image. How are humans designed? What do we think? Well, we were designed for physical activity and social engagement. Our ancestors hunted, gathered, and we built groups. So is physical activity important? Yes. Modern researchers have found that outdoor activity in a natural environment reduces stress and promotes health. I am someone who is a huge proponent of this method of improving our mental health, and I try to get outside and do some sort of physical activity every single day. How important is aerobic activity? Well, physicians and psychologists agree. Regular aerobic activity, playing basketball, walking, running, swimming, a multitude of things, shooting a soccer ball with friends, they contribute to overall physical and mental well-being. What about socializing? Studies show friendships and group involvement also are important, and they help satisfy the need to belong. Sleep is critical. As we discussed in Module 24, adequate sleep is essential to both physical and mental health. Well, do lifestyle changes actually help relieve depression? Well, an initial study showed that participants engaging in lifestyle change therapy experienced relief from depressive symptoms. So yes, changes in lifestyle can actually relieve depression. Now, the term psychopharmacology sounds complicated, right? But it is really the study of the effects of drugs on mind and behavior. And since the 1950s, discoveries in psychopharmacology have sort of revolutionized the treatment of people with severe disorders, liberating hundreds of thousands from hospital confinement, those that didn't have any sort of treatment before. So thanks to these drug therapies and local community mental health programs, the resident population of US state and county mental health hospitals is now a small fraction of what it once was in the mid-20th century. So how was psychopharmacology initially received? Almost any new treatment, including drug therapy, is greeted by an initial wave of enthusiasm, as many people seem to improve. So it's often initially that new drugs are really, people are really excited about them, enthusiastic about them. So there's some different types. And what are antipsychotic drugs? Well, they're drugs used to treat schizophrenia and other forms of severe thought disorder. So first generation antipsychotics, such as Thorazine, dampened responsiveness to irrelevant stimuli. They provided the most help to patients experiencing those positive, remember, not positive in the fact that you want them, just in addition to those positive, actively inappropriate symptoms of schizophrenia, such as the auditory hallucinations and paranoia. But there were some side effects, some pretty powerful side effects of those original antipsychotics. Some produced sluggishness, tremors, and twitches similar to those of Parkinson's disease. Long-term use of those antipsychotics can actually produce what is known as tardive dyskinesia, with involuntary movements of the facial muscles, such as grimacing, tongue, and limbs. And these are long-lasting side effects. So what is the impact of dopamine from antipsychotic medications? Well, the molecules of the most conventional antipsychotic drugs are similar enough to the molecules of the neurotransmitter dopamine, think back to our biological basis of behavior modules, to occupy its receptor sites and block its activity. Antipsychotic drugs act as an antagonist for dopamine. This finding reinforces the idea that an overactive dopamine system may be likely what is contributing to schizophrenia. Anti-anxiety drugs are used to control anxiety and agitation. Like alcohol, anti-anxiety drugs such as ones you may have heard of, Xanax or Ativan, depress the CNS. Some anti-anxiety drugs have been successfully used in combination with psychological therapy to enhance exposure therapy's extinction of learned fears and to help relieve the symptoms of PTSD and OCD that we just talked about in earlier modules. How about antidepressants? Well, they're drugs used to treat depression, sometimes anxiety disorders, OCD, and PTSD. Many antidepressants work by increasing the availability of neurotransmitters, such as norepinephrine or serotonin, which elevate arousal and mood and are scarce when a person experiences feelings of depression or anxiety. SSRIs, selective serotonin reuptake inhibitors, sort of a mouthful to say, but several widely used antidepressant drugs are these SSRIs. The most common ones are Prozac, Zoloft, and Paxil, and they work by prolonging the time serotonin molecules remain in the brain synapses. How does neural transmission with serotonin typically work? Well, the neural message is sent across the synaptic gap. You can look at this good image that shows us kind of what I'm talking about. With the release of serotonin and received in the receptor sites on the postsynaptic neuron. After the message passed to the postsynaptic neuron, excess serotonin is reabsorbed by the sending neuron through a process called reuptake. Prozac, again, as I mentioned, is an SSRI that partially blocks normal reuptake of the neurotransmitter serotonin. Excess serotonin in synapse enhances its mood-lifting effect. So double-blind trials. We mentioned these when we talked about research methods early on in Unit 2 of the Myers textbook. In double-blind clinical trials, placebos produced improvement comparable to about 75% of the active drug's effect. For those with severe depression, the placebo effect is less, and the added drug benefit somewhat greater. So this tells us that maybe if one suffers from mild depression, there might be alternative therapies that work as well as medication. Considering that placebo effect, what is the recommendation for use of antidepressants? Well, Irving Kirsch of the program and placebo studies at Harvard recommends limited antidepressant use, since antidepressants often have unwanted side effects, and aerobic exercise and cognitive behavioral therapy, that CBT therapy, are also quite effective antidotes to mild or moderate depression. So he says that if antidepressants are to be used at all for mild or moderate depression, they should be a last resort after those other things are tried first. Mood stabilizing drugs help to control the manic, out-of-control feelings that often come with bipolar or other disorders. Depakote, an older mood stabilizer, was originally used to treat epilepsy. It was also found effective in controlling the manic episodes associated with bipolar disorder. Another simple salt, lithium, effectively levels the emotional highs and lows of bipolar disorder. So what do we know from the research about the benefits of lithium? So about 70% of people with bipolar disorder benefit from a long-term daily dose of lithium, which is a simple salt, which helps prevent or ease manic episodes and to a little bit of a lesser extent lift depression. Taking lithium also correlates with a lower risk of suicide among people with bipolar to about 1/6 the risk of those not taking lithium. So that's rather large. Naturally occurring lithium in drinking water has also correlated with lower suicide rates across 18 Japanese cities and towns and lower crime rates across 27 counties. So ECT, electroconvulsive shock therapy, sort of a shocking term for us to hear. It's a biomedical therapy for severely depressed patients in which a brief electric current is sent through the brain in an anesthetized patient. In ECT, the patient receives a general anesthetic and a muscle relaxant to prevent body convulsions. A psychiatrist then delivers a brief pulse of electrical current, sometimes only to the brain's right side, which triggers a 30 to 60 second seizure. Within 30 minutes, the patient awakens and remembers nothing of the treatment or of the preceding hours. And this is kind of what it looks like. How effective is ECT? Well, a Journal of the American Medical Association editorial concluded the results of ECT in treating severe depression are among the most positive treatment effects in all of medicine. So transcranial direct stimulation, in contrast to ECT, which produces a brain seizure with about 800 milliamps of electricity, transcranial direct current stimulation administers a weaker current to the scalp. After reviewing recent studies, 2 European expert panels reported the probable efficacy of this as a treatment. So it's got some positive results. How does it work? Well, the psychiatrist applies a weak current to the scalp in this way that you see on this image on the right. There's repetitive transcranial magnetic stimulation as well. It's the application of repeated pulses of magnetic energy to the brain, which is used to stimulate or suppress brain activity. It's performed on a wide awake patient rather than being put under over several weeks. Repeated pulses surging through a magnetic coil held close to the skull can stimulate or suppress activity in areas of the cortex. This procedure produces no memory loss or other serious side effects aside from some possible headaches. In this procedure, psychiatrist sends a painless magnetic field through the skull to the surface of the cortex to alter brain activity. Then there is deep brain stimulation. Patients whose depression has resisted both drugs and ECT have benefited from an experimental treatment pinpointing a neural hub that bridges the thinking frontal lobes to that limbic system, more of that emotional system. Since 2003, researcher Helen Mayberg and her colleagues have used DBS to treat some 200 depressed patients via implanted electrodes in the subcallosal cingulate, brain area that functions as the neural sadness center. So is there a depression switch? Well, by comparing the brains of patients with and without depression, the researcher, Helen Mayberg, identified a brain area, which you can see highlighted in red right there, that appears active in people who are depressed or sad, and whose activity may be calmed by deep brain stimulation. How does DBS work? Well, psychiatrists stimulate electrodes implanted in those sadness centers to calm those areas. There's also psychosurgery, which removes or destroys brain tissue in an effort to change behavior. Of course, this is a very last resort type of thing. Because of its effects are irreversible, psychosurgery that removes or destroys brain tissue is the most drastic and least used biomedical intervention for changing behavior. We mentioned earlier on, if you've listened to any of these other lectures, the procedure of lobotomy, a psychosurgical procedure once used quite frequently earlier on to calm uncontrollably emotional or violent patients. In the 1930s, Portuguese physician Egas Moniz developed what would become the best known psychosurgical operation, the lobotomy. He found that cutting the nerves connecting the frontal lobes with the emotion controlling centers of the inner brain calmed uncontrollably emotional and violent patients, but with some severe side effects that made typical life almost impossible for a lot of these patients that underwent this surgery. There were lots of failed lobotomies. And this is one famous example of failed lobotomy. This 1940 photo shows Rosemary Kennedy in the center at age 22 with her brother and future US President John F. Kennedy and sister Jean. A year later, her father, on advice from medical professionals, approved a lobotomy that was promised to control her reportedly violent mood swings. The procedure left her confined to a hospital with sort of an infantile mentality until her death in 2005 at age 86. A very sad story. Is psychosurgery still used today? Precise microscale psychosurgery is sometimes used in extreme cases such as uncontrollable seizures. Surgeons can deactivate the specific nerve clusters that cause or transmit the convulsions. MRI-guided precision surgery is also occasionally done to cut circuits involved in severe OCD. Because these procedures are irreversible, they are only performed as a last resort. Here is a sort of a chart of comparing the different biomedical therapies. I'll leave this up here for a minute for you guys to check out. Okay, what is the traditional thinking regarding disorders? Well, psychotherapies and biomedical disorders tend to locate the cause of psychological disorders within the person. We infer that people who act cruelly must be cruel, and if they act crazy, they must be sick. We attach these labels, sort of distinguishing them from normal people. It follows that we try to treat abnormal people by giving them insight into their problems or by changing their thinking or giving them some sort of drugs. But is that the only viewpoint? Well, we can interpret many psychological disorders as understandable responses to a disturbing and stressful society. According to this view, it's not just the person who needs treatment, but also the person's social context. Better to prevent a problem by reforming an unhealthy situation and by developing people's coping competencies than to wait for and treat problems. That's kind of a mouthful. Okay, so this is all about what can we do for prevention. The term resilience is used a lot in the field of psychology, the personal strength that helps most people cope with stress and recover from adversity and even trauma. Faced with unforeseen trauma, most adults exhibit resilience. More than 9 in 10 New Yorkers, although stunned and grief-stricken by 9/11, did not have a dysfunctional stress reaction. Especially resilient were those who enjoyed supportive, close relationships and who had not recently experienced other stressful events. Post-traumatic growth is positive psychological changes as a result of struggling with extremely challenging circumstances and life crises. Struggling with challenging crises can even lead to post-traumatic growth. For instance, many cancer survivors have reported a greater appreciation for life, more meaningful relationships, increased personal strength, changed priorities, and a richer spiritual life. So you can see the positives of, that can follow having a significant type of traumatic situation. So back to the learning targets. There are quite a few to go over. Therapeutic lifestyle change is considered a biomedical therapy because it influences the way the brain responds. Mind and body are a unit. Affect one and you will affect the other. Our exercise, nutrition, relationships, recreation, relaxation, and religious spiritual engagement affect our mental health. So people who undergo a program of adequate aerobic exercise, sleep, light exposure, social engagement, rumination reduction, and better nutrition have gained relief from depressive symptoms. Psychopharmacology, which is the study of drug effects on mind and behavior, has helped make drug therapy the most widely used biomedical therapy. Antipsychotic drugs used in schizophrenia block dopamine activity, but side effects may include tardive dyskinesia, those involuntary movements, or increased risk of obesity and diabetes. Anti-anxiety drugs, which depress CNS system activity, are used to treat anxiety disorders, OCD, and PTSD. These drugs can be physically and psychologically addictive, though. So you can hear there are side effects for a lot of these. Lithium and Depakote are mood stabilizers prescribed for those with bipolar disorder. Studies may use things called the procedures, double-blind procedures, to avoid the placebo effect and researchers' bias. Antidepressants increase the ability of serotonin and norepinephrine, are used for depression, often with modest effectiveness beyond that of placebo drugs for mild and moderate depression. Antidepressants known as SSRIs are now used to treat other disorders, including strokes, anxiety disorders, OCD, and PTSD. ECT, that electroconvulsive therapy, in which a brief electric current is sent through the brain of an anesthetized patient, that means they're put under, is an effective treatment for severe depression for those who have not responded to other therapy. Transcranial direct current stimulation administers a far weaker current to the scalp. And then there are some newer alternative treatments, including repetitive transcranial magnetic stimulation, and it has some good preliminary results that calm an overactive brain region linked with negative emotions. Psychosurgery is a radical procedure that removes or destroys brain tissue in hopes of modifying behavior. It's sort of a last resort treatment because its effects are irreversible. Lobotomy was once quite popular, but neurosurgeons now rarely perform brain surgery to change behavior or moods because of the possible terrible side effects. Preventative mental health programs, prevention programs, are based on the idea that many psychological disorders could be prevented by changing oppressive, esteem-destroying environments into more benevolent, nurturing environments that foster growth, self-confidence, and resilience. Building resilience might prevent some disorders or even enable post-traumatic growth after some sort of traumatic event. Okay, that's it. Thank you so much for listening. Take care.